outset, I thank the organizers and CME chairperson for giving me an opportunity to give my views. Not working? Hello. So to express my views on LGBT psychological aspects. Yes. Hello?
Yes.
Yeah, thank you. To express my views on LGBT psychological aspects. Well, we are on the world, or we are in the country, where even imparting sex education raises the eyebrows, creates the uproar. Not only that, Parliament has to appoint a special committee which banned sex education in secondary and higher secondary school in 2009. So this is the attitude towards the normal sex education. So public discussions on homosexuality is very, very difficult and probably not acceptable. Well, we all know that LGBT created uproar amongst the Indian Psychiatric Society also only before a few months. And so what I'll be talking about LGBT is based on some evidence-based and some of experience of my clinical practice as I'm working as a sex therapist also. So whatever I'm speaking, please remember that it's total and don't pick up any statement of mine. Otherwise, it may create undue controversy. What is LGBT? That is, homosexuality is in the body of mind. It's a biopsychosocial condition. Religion, culture, all has the influence on this LGBT status of an individual. Homosexuality is markedly stigmatized and it is kept under closet. However, there is a marginal shift in the attitudes of the society towards this LGBT population, especially because of the media, because of some of the voluntary organizations supporting, and because of the recent films in the Bollywood, like Fire and My Brother Nikhil. Usually Bollywood depicts which ridiculed the homosexuals earlier, but there are some positive films, that's Fire, My Brother Nikhil, Honeymoon Private Limited, Pink Mirror, etc. We all know that there is a depiction of homosexuality in the ancient Indian scriptures. You know about Kam Sutra, in which Vatsayana has talked about the homosexuality. In Greek mythology, there is also depiction of the homosexuality. However, it still remains mystery in the mind of the many experts whether this population will be given its normal psychosocial status or not. Our government is still not clear about it. Now, what is the prevalence of LGBT? There are several studies world over carried out. So far as the transgender is concerned, much studies are not there. But so far as homosexuals and lesbians are concerned, there are some studies. Several studies, I just summarize the data, that 18% of the female and 21% of the male in US experiences either same-sex attraction. I reiterate, they experience either same-sex attraction or behavior after the age 15. Fewer of these, which is not clear because there are conflicting data, fewer of these 18% and 21% engages in the same sexual activity, and far fewer identify themselves as LGBT. So they come out of the closet and identify themselves. India has a population of 25 gay men as per the government report to the Supreme Court in the last petition. The transgender population which was estimated in the last census was 4,90,000, which is probably 6 to 7 times more, as people are not happy to register themselves in the census as third gender. While data on population of the lesbians and bisexual is not on an official government list, some NGOs are claiming, but there are no clear-cut data so far as our country is concerned. So there is a marginalization of a huge chunk of the population, not only in our country, but worldwide. LGBT is associated with significantly increased level of the mental health problems compared to heterosexual individuals, including wide range of mental disorders, depression and suicides. Their elevated mental health problem is not only because of their LGBT status, but because of the homophobic attitude of the heterosexual society, and because they cannot express their sexual expression, and as a result of that, they are having several mental problems. So what is the role of the psychiatrist in this? We as a psychiatrist need to bridge the gap that separates the people on the basis of their sexual preferences, inculcate healthy environment. We have to initiate the crusade, which first of all need to understand the psyche of the individuals tagged under the category of the LGBT. So we'll try to know what is psyche of the LGBT. What is closet homosexual? This is very important for each and every psychiatrist to know. A homosexual who hasn't told anyone about his or her sexuality. There is a huge chunk of the closet homosexual, not only in our country, but in the Western country. David Beckham was one of the persons considered to be the closet homosexual. There are numbers of such celebrities, those who are closet homosexual. He is a closet homosexual is a person who is someone who is gay or bisexual and afraid to show it in public. A gay person who wants to keep their true sexual orientation a secret. Sometimes what they do, this closet homosexual, even deceive by making a big show of dating the opposite sex to hide their gayness. Now you'll be surprised by this argument, what anti-gay people, those who are arguing. There are some arguments in the courts and arguments outside the courts, and they say that this closet homosexuals, which is a very huge chunk, they are the supporters of the gay movement. This is what people have said. There are certain evidences. These supposedly straight people, they say supposedly straight people spend all their time defending homosexuality. That is clear that they must be gay themselves, hence their obsession with it. They call anyone who finds disgust with homosexuality a bigot. Their common argument, which is also illogical against gay haters, is that they must be gay themselves, because they find the concept of two gays repulsive. Perhaps it's these gay defenders who are gay themselves. Now, closet homosexuals are coming in a large number in a clinic of a psychiatrist and sex therapist. As per the estimation, 4 million female in the USA, those who have a network, if you check, go to the nets, there is a network, and 4 million female in the US are married to the closet homosexuals, and they have expressed their pain and whatever marital problems were there. We do not have the estimation in our country that how many females are married to the closet homosexual or males are married to the lesbian. That's not clear. But there are numbers of incidences of unconsummated marriage. At least 5 to 10% of the marriages or the couples coming for the sex therapy, they have not consumed their marriage. There are numbers of incidences of low sex and no sex marriages in the middle-aged and elderly. And if you go in deep down into their psyche, then probably homosexuality can be one of the causes. How the case will be presented, I'll give you an example. A boy came to me with some of the problems in his career and some of the pressure from his father, and he was having depression. Father was pressurizing him to get married. I had asked him several questions because he was resisting marriage. I pinpointedly asked one question in the first session only. But the boy was not giving any answer. Second time after prescribing antidepressants, he said that I want to talk to you, and he admitted that he is homosexual. That was the first ever admission, or first ever he expressed or admitted that he is homosexual in his life. But he said, I said, what do you want to do? He said, I don't want to change my orientation, but the problem is that my father is having heart attack, and he will be undergo bypass surgery. I offered him that I'll help explaining your parents about your problem. He said, oh, I'll come, maybe heart surgery of my father is over. 3 months after that, police came with the inquiry that is this the prescription prescribed by you, doctor, to this gentleman? I said, yes. He said, of which disorder he was suffering. That man committed suicide. He never disclosed to his father, never gave the opportunity. Similarly, there are numbers of youths when we conduct the sex education programs in the schools and colleges. And when we give them the forms, there are numbers of youths. They may admit that they are homosexuals, but it's difficult for them to come out of the closet. You remember, it's difficult even in the US, however the law is permitting. If there is a decriminalization of this LGBT in US and other countries, however, people are remaining under, large chunk is remaining under closet so far as the homosexuality is concerned. In our country, the condition is worse. Remember, there are several cases of the low-sex marriages, in which also a person, after having enjoyed sex with the wife, he has a desire, he may be having homosexual contact prior to the marriage, and then once again after successful marriage and having successful children, he may be having the contact and he may enjoy this sex, and then he will have several mental problems. I know about a doctor who was coming to me even before his marriage. He got married to a lady because there was a family pressure, but earlier he had homosexual experiences. You see, by therapy, aversion therapy and behavior therapy, there was a working relationship with wife was established, and he was having at least good frequency of the sex with wife. Of course, very little emotional feeling. They produced 2 children. One of them was a postgraduate in the medical college, and that person was working as a general practitioner. What happened? After many years, he got one staff compounder who was allowing him to have the sex with which he wanted, and once again he became homosexual, which came very well known in the town. Now what happens? So there are many people, those who are coming to us for the treatment, and we can't simply say that we cannot change your orientation, or law, if law sometimes prohibits us completely from treating the homosexual, then that law cannot be accepted. Because homosexuals are also having a lot of homophobias and conflict within themselves, and they also require good counseling, and they also require to be comfortable with their own sexuality. And that's why we should, as a psychiatrist, we should know how to treat all this population in our clinic. What homosexuality, psychoanalysis say about homosexuality? Sigmund Freud says that bisexuality is a normal part of the original libido. Sigmund Freud also said that homosexuality is one of the many sexual options available to the people. Humans' inherent bisexuality leads to individuals to eventually choose which expression of sexuality is more gratifying, and because our society is highly inhibitive, homosexual expression is not gratifying to the people, and that's why they are becoming more heterosexual. Freud views homosexuality as an arrest of psychosexual development, castration, fear of maternal engulfment in the pre-adolescent phase. Lack of resolution of this peniscentrian Oedipus complex, where individuals begin to identify with their mother and take themselves as a love object. This love of one's own self, which is defined as narcissism. People who were high in the trait of narcissism would more likely to develop homosexuality, because love of the same sex is like an extension of the love to oneself. Havelock Ellis has a different views, and he says that homosexuality arose out of strong feeling of inadequacy born of fear of failure in relations with the women. The restrictive society contributes to the development of the same-sex love and same-sex relations. He proposed that being exclusively homosexual is a deviant. However, society should accept these deviants as normal, because otherwise they are good people. Kinsey explained hetero and homosexuality. In his extensive surveys and reports, Kinsey defined 7 points ranging from exclusively heterosexual in fantasy and behavior to exclusively homosexual in fantasy and behavior. And he has said 4% are exclusively homosexual, 13% were predominantly homosexual, 13% reported having related to erotically to other males during their childhood. 2 to 6% of the married women and 1% of the married women were predominantly lesbians. These were several data from the Kinsey's report. What the psychodynamic theory tells about the male homosexual behavior? Strong fixation on the mother, lack of effective fathering, fixation at or regression to narcissistic stage of development, gay men have same-sex fantasies before 3 to 5 years, at the age of 3 to 5 years, about their father or the father's surrogates. Most gay men have reported onset of romantic and erotic attractions to same-sex partners during early adolescence. What are the life experiences contributing to the homosexuality? Extensive research have been carried about the life experiences, and child sex abuse is one of the most common life experience. That's what most of the homosexuals have expressed. Usually, the data of the child sex abuse is under 4%. Boys are molested by the men. A recent major study found that the rate of the childhood molestation by men amongst homosexual or bisexual men were nearly 10 times, that is the 35%. Sex very early. What happens? Persistent emotional struggle reported by men and women to experience child sex abuse. What happens after child sex abuse? There is anger, there is rage, betrayal, loss, intense fear, helplessness, and loss of control in the victim. Sexual identity confusion will be there. Why I was chosen for these? Am I looking like a girl? Am I girlish? Am I feminist? So the question on the masculinity or the femininity will be started. Most of the boys are abused, so question of the masculinity will be there. Lack of belief in the legitimacy of both the abuse and the after effects. Enduring negative beliefs about self and others. If you have negative beliefs about self and others, repressed or compulsive sexuality, shame and humiliation. Abuse breaks a man's sense of power, because those who are overpowered by a man, their sense of power is broken very badly. And as a result of that, the desire for power can become fixated on the male genitalia and fuels an attraction to it, really more about power than about sex. So those who are abused, they then turn into the homosexual because they want more power, so they fixate more on the penis. This is the result of the life experiences. Because of child sex abuse, heterosexuality is derailed. Not all men, however, who are sexually abused grow up to identify as a gay or have sex with other men. Not all. Men report different paths to homosexuality and have different responses to sexual abuse. But for many of the men who are sexually abused, the abuse is one of the steps on the road towards developing the same-sex relationship. The adult sexuality inflicted on these boys influences their burgeoning identity, sexuality and behavior, and later on they become homosexual. Sexual abuse derails biological priming also. Sexual abuse contributes to the derailing of the biological priming. Dr. Panadurai has said that there is no biology, but I'll show you one slide about the biology. Boys who are targeted for sexual abuse are not targeted because they are gay or they look like that or they are vulnerable. Gender non-conformity, which is the only characteristic that is predictive for later homosexuality, is often characteristic of these vulnerable boys. It creates confusion and lowers self-esteem of the victim. Sexual abuse causes confusion between the man I am, the man I want to be, and the man the world expects me to be. My perception has been skewed. These are the verbatim of a patient after child sex abuse, that my perception has been skewed by my experiences of sex, and I feel weak, angry, tentative, attractive, unattractive, fearful, indecisive, and depressed. So he will be having lower self-esteem. Early childhood development as a boy. Other than child sex abuse, what is responsible is early childhood development. You see, the research is carried out by the homosexuals, those who have described about their early childhood development up from their memory. And memory may have maybe distorted sometimes, but on the basis of that, some scientific studies are also there. Studies to development aspect of the homosexuality have been done in past 10 years, but they have been primarily on the male and not on the female. So on the basis of this study of these male, those who were in the therapy for one or the other reason, and those who were gay or lesbian or bisexual, and whatever their memories of the childhood experiences and some research, the findings are there. Nature and nurture are vital elements in developing all humans. Pre-homosexual boys is fraught with conflict and self-doubts and problem with self-esteem. These children encounter subtle and unsettled form of rejection and misunderstanding from their social environment, even from the family. Suppose father wants a boy to be a good athlete, and the boy is not becoming a good athlete, but he is taking more time in getting ready and some makeup and etc. And father is then not showing good attitude, and then he is angry with that. He is keeping distance. I had a patient. One was homosexual, and he described his father as a rejecting and distant. There is a twin. I called his brother, who was a twin. The patient gave the reason why he was distant. He says that most of the time father was remaining away from me, and whenever he was coming to me, he was scolding me. Another man who was a twin and who was not homosexual, he said that, no, my father had a job of, the kind of the job was that he required to stay out. Otherwise, he never rejected me. So this is a matter of perception which leads to these. Friedman suggested that lack of traditional masculine interest and aversion to the rough and tumble play and physical conflict are another characteristic that correlates with later homosexuality. There are clear genetic and prenatal hormonal factors responsible for these also. Latency in development, you know, by the age of 2 or 3, most of the children have developed clear-cut gender identity. In the early latency, there is a shift in the interest, and child may find that I am something different than others. There is an ego ideals. If child is in a peer group and friends are discussing about the suppose film hero, then if one person says a film hero who is a girlish type, he says that he is my ego ideal, then other will make a mockery of that boy. And from this, the child will start developing a complex that I am something different than other. He will remain isolated and keep himself distant, that there is something different is going on. So early experiences of the childhood, I will not go into the details of that. Latency developed in pre-homosexual boys. Psychology of feeling of being different, often inexplicable both to child and to the environment. The typical latency age child increasingly develops a sense of well-being, both in the public and the private. Usually, even the private or mental life is to be considered consistent with the socially acceptable models. And this early feeling that I am something different is gradually transformed into a tendency towards the homosexuality in maybe early adolescent phase or latency phase. Then what in the adulthood psychological perspective of the LGBT? A number of studies have been documented the direct effects of the gender non-conformity and sexual minority status in social experiences of the LGBT. As example, there may be school victimization, there may be negative family experiences. They are largely responsible for the elevated levels of the negative psychosocial adjustment and health among gender non-conforming youth and young adults. Critical mental health issues for lesbian, gay and bisexual, stress associated with management of the lesbian, gay and bisexual identity. They have a biggest problem in establishing their own identity and they are facing a lot of stress. During this stress period, many will come with somatic symptoms, many will come with sexual symptoms, many will come with frank symptoms of depression. Sometimes you may feel that child is avoidant or child is having two-night vow, there may be career issues, there may be scholastic backwardness. You require to interrogate the child in a detail and try to resolve. At this juncture, when the child is not fully homosexual, you can definitely counsel on the basis of whatever the family value is there and whatever is the socially acceptable norm. Disruption in the peer relationships, that is another stress. Conflict about disclosure to family and consequences of disclosure. They are always afraid when to disclose, how to disclose, what will be the consequences, whether father will react, mother will react, how the society will react. They will be victimized, they will be beaten. There are incidences in US that school children are bullying those who are declaring themselves as gay. So others are bullying. So that's a victimization in the office, victimization everywhere. And because of that, they are under constant fear. Emotional reactions to close relationship development, isolation from lesbian, gay, bisexual, affirming context. They keep away from these also, these people also. Distress caused by discrimination, harassment and violence based on sexual orientation, and anxieties related to the sexual health, especially HIV, maybe in the middle-aged, maybe in the adult population, maybe in the old age. HIV is one of the issues for which they have some mental disorders. So Mayer has given a minority stress model According that LGBT individuals are at increased risk for mental health distress because of their stigmatization of sexual identities. Gender non-conformity and stress, because gender is not confirmed, because of that there will be stress. This is also identified by Skimorit and Stanford in several research, that because of the gender non-conformity, stress and mental illness is more in this population. Biological factors of the gay men. Gay men have lower level of circulating androgens than heterosexual men. Deficiency of prenatal androgens may lead to sexual orientation towards male. Pre-adolescent girls exposed to large amount of androgens before birth are uncharacteristically aggressive. Boys exposed to excessive female hormone in utero are less athletic, less assertive and less aggressive than other boys. Women with hyperadenocorticolism are lesbian and bisexual. Genetic predisposition is also established. A group of cells in hypothalamus in women and gay men are smaller than heterosexual men. These all research are at the primitive level and still further research are required. Mood and anxiety disorders are more. Ferguson and colleagues have estimated that mood and anxiety disorders are 1.8 to 2.9 times more likely to be experienced in LGBT population than the normal heterosexual population. Depression and suicidality is very common. Suicides in LGBT, particularly because they are not accepted, they cannot express the feeling and they cannot be in the common stream of the society. That's why the suicide is very common. Some population-based studies followed more than 2 decades of community-based studies of LGBT youth show elevated reported rates of suicidal ideation and attempts. Risk factors including depression, substance use, early sexual initiation, not feeling safe at school, cigarette smoking and inadequate social support. These are the causes or risk factors for the suicide. Family rejection due to sexual orientation, greater childhood, parental psychological abuse and parental efforts to discourage gender atypical behavior were associated with increased risk of suicide. So, for summary and conclusion, homosexuality is said to be the condition of mind and body, and we all know that. As a psychiatrist, we need to bridge the gap between the homosexual individuals and the society. We should not be the active, we should not be like the LGBT activist completely and talk about that. At the same time, we should try to see that they are comfortable with their sexuality. I do not believe, particularly after treating so many cases of low sex and no sex marriages in which the partner had, the male partner had homosexual experiences, maybe for 2-3 years or maybe for the lifelong, they are bisexual and they are married. Ours is a society when marriage is fixed up by the family and overnight you cannot change anything. As I already told you, that in liberated society like US, there are more number of homosexual under closet. So even the law will come tomorrow. There will be large chunk of the people, they will be under the closet, and that's why we require to understand them, we know them, and to treat them without any bias. We shouldn't have any bias that this person is homosexual, we should be comfortable in discussing with them. At the same time, if some person, because most of the time when they are coming or when they are brought by the relatives, they are brought with one purpose only, that whether the orientation can be changed or not. And sometimes a person who is already married for 2 to 5 years, he might have not consumed the marriage, but you are not left with any other alternative but to work with that person. And from my own experience, I'll say that if you work with child sex abuse, like PTSD, if you go for the psychotherapy and cognitive behavioral therapy and give sex education and some aversion therapy, then it can definitely work and it can definitely help. So we should keep our options open between everything. We should be open for the LGBT people that yes, they should be given the acceptance. At the same time, there are incidences that some LGBT people are dragging some of the child by child sex abuse. That also should be prevented. Once child is having homosexual orientation because he is abused, then we should not scam that here is the orientation and it cannot be changed. This is because this is what DSM says, this is what APA says. That should not be the stage, and we should practice openly so that our clients are comfortable with their sexuality. Large number of closet homosexuals get married because of homophobias. Psychiatrists can come across several cases facing clinical dilemma and whether to treat or not and how to treat. Whether to treat and how to treat, these are very important things, and the time given is very less. Otherwise, I would have given my own module in which, by which a person can be treated, if the treatment is required. The role of mental health professionals must take the lead in developing affirmative services and creation of supportive setting for the lesbian, gay and bisexual youth. We must not victimize these youths again by polluting with social and political forces that render them invincible in public schools, on college and university campuses and community settings. We cannot ignore the pervasive heterosexism, homophobia and discrimination that occur in the social context in which they spend a crucial decade of their preparation for adulthood. Increased professional attention must be directed towards helping lesbian, gay and bisexual young people deal with the distinct dilemma of becoming a lesbian, gay, male or bisexual adult. The need for intervention directed towards this population is very intense and urgent. With this remark, thank you all for the patient hearing.